My name is Jason Wild, and I am a fourth year medical student at the Florida Atlantic University Schmidt College of Medicine. Happy to present this case of persistent psychosis following a postpartum hemorrhage. Severe hemorrhage is a complication associated with pregnancy and miscarriage and can result in serious damage to vital organs, including the brain. Pregnancy and childbirth is also associated with hormonal changes and resulting psychiatric presentations in patients who may not have any notable prior psychiatric history. In this case, we present a patient with persistent delusions after having suffered a severe hemorrhage following a miscarriage. The patient, who we have named Sally to protect her identity, was a 47-year-old female who presented to our acute psychiatric care facility under Law Enforcement Baker Act due to aggressive and irrational behavior. Several years earlier, Sally had suffered a postpartum hemorrhage resulting in a hospitalization involving a coma that lasted for 3 to 4 days. After the hospitalization, per her mother, she experienced decreases in her cognitive function, difficulty fulfilling ADLs, as well as persistent delusions and change in her behavior. These symptoms have persisted in the years following her miscarriage, and she's still often seen responding to internal stimuli at home, per her mother. Her mother states that she's often fixated on returning to a home, husband, and children that do not in fact exist. On interview with the patient, she continued to believe that she had to return home to her husband and children, stating that she was the chief of police and a number of other verifiably false details. Given her history of severe hemorrhage, we pursued neuroimaging and CT scan of the head, which revealed diffuse cortical atrophy. A brain MRI was also ordered, but was not performed due to patient and family preference. The results from the CT scan suggest that her anoxic brain injury from her postpartum hemorrhage may be the origin of her psychiatric symptoms. Now, in noting the differences between this case and postpartum psychosis, there are a number of key details that differentiate the two. In postpartum psychosis, this is characterized as a subtype of brief psychotic disorder occurring in the 2-week period following childbirth, although 50 to 60% of patients can experience prolonged symptoms. Postpartum psychosis is also characterized by its strong association with a history of type 1 bipolar disorder in affected patients, although up to 50% of patients with postpartum psychosis have no prior psychiatric diagnosis. In choosing a differential diagnosis for this case, given her known history of hemorrhage and subsequent coma in the postpartum period, combined with evidence of cortical atrophy from the neuroimaging results, psychosis due to anoxic brain injury is more likely than postpartum psychosis. Psychosis due to anoxic brain injury is much more likely given the proximity of the onset of her symptoms with the hemorrhage and her lack of prior psychiatric diagnosis. In reviewing the literature, few case reports exist correlating postpartum hemorrhage with resulting brain damage and subsequent development of psychotic symptoms. One case report that we found described a patient with postpartum with postpartum hemorrhage resulting in a coma, and imaging revealed atrophy of the posterior pituitary, which is also known as Sheehan syndrome, which has a number of resulting hormonal changes and can also present with persistent delusions, as with that one case report. An additional case report that we found described acute hemorrhage following a cesarean section with resulting damage to the cerebral cortex. Organic psychosis secondary to hypoxic ischemic brain injury was decided as the diagnosis in that case report. Again, given the proximity of the hemorrhage and the onset of her symptoms and the persistent delusions in this patient, it's likely that the postpartum hemorrhage resulted in the psychiatric symptoms that our patient suffered.